There is a non-invasive option, actually options to treat joint and nerve issues. Here's more on how you can get more details. If you're in search of some relief from joint or nerve pain, we may have found the spot for you. I'm with Dr. Lawrence Bourgeois. He is also the president here of Next Genesis Healthcare San Antonio, and Dr. Amar Casarla. Thank you for having me, gentlemen. So tell me a little bit about neuropathy for our audience. Maybe they have it and they don't even know.
Yes, so neuropathy is nerve damage. It's when the nervous system isn't working at its optimal level. The common symptoms they get are going to be burning, numbness, tingling, shooting pains, balance issues, which is a big issue. And then a lot of times, if it gets bad enough, because it is a progressive condition that constantly gets worse unless you do something about it, it's amputation's a real threat.
That is a scary situation. We wouldn't want anyone to get to that point. Therefore, you guys have treatments here that may be a good option for our audience.
Yes. So we work to reverse the symptoms of neuropathy naturally without any medication or surgery. Okay, we want to get to the root cause of the problem and go from there.
Okay, I know you have a patient that we want to hear from right now that is going to give some testimonies.
Yes, absolutely.
Both of my shoulders, both of my thumbs, and my left big toe. Twice a year I get steroid or cortisone. After the very first treatment, I called my doctor and canceled shots in my shoulders and my thumbs. Didn't need them. I've never had another shot. I have not had any pain in my shoulders. Absolutely changed my life.
All right, well, that sounded very helpful, Dr. Casarla. Nerve pain is one thing, but then we also have joint pain, so you also focus on joint rejuvenation.
Yes, we do. We can treat every joint in the body because most of the joints degenerate with age, causing arthritis. Also prone for injuries either from accidents or sports related. Most commonly what we see are the big joints in the body like hips, knees, shoulders, elbows, and the lower back.
And what is the treatment for that?
What we trying to do is enhance patient's own ability or to heal by using bone marrow or adipose tissue, which are also called fat cells, and which contain a lot of hormones and growth factors. And also we use advanced modalities along with that to treat it, which patients haven't tried before, and they're tired of using regular medication and surgeries.
But you do have a patient who has received treatment for joint rejuvenation, and we're going to hear from them.
Yes, we do.
The experience has been remarkable. Pain, the first treatment, I couldn't believe the inflammation went away the very next day, 24 hours later. I'm amazed. I say don't live with the pain, just get rid of it. Don't exchange money for pain.